There have been 2 clinical trials recently reported that work on eliminating the aggregated form of synuclein. And it turns out that in both cases, the drugs came into trials with a robust evidence that they actually do so. And so these trials were done with the idea of testing the hypothesis that an anti-synuclein approach, such as that afforded by these immunotherapies, could in fact bring on benefits. And the outcome of both was in fact negative. The assumption is made that perhaps target engagement, which is impossible to measure because we don't have a radioligand that can capture the insoluble fraction of synuclein in the brain, prevents us from determining whether there was any target engagement, whether in fact we were able to reduce the insoluble levels of synuclein. But the evidence is that even with that gap in our knowledge, the results aren't moving in the direction that it was that we hypothesized. And as such, I think it's important for us to rethink the relationship between synuclein and disease, and perhaps to think that synuclein is in fact quite important for the brain. It's all over the body, brain included, and once we lose it because it's becoming entrapped in insoluble amyloids, it no longer can provide its function. And so the loss of the normal protein may in fact be much more relevant than the accrual of the insoluble fraction of the protein, what we call Lewy pathology. This is consistent with the fact that there has been no relationship between the burden or the distribution of Lewy pathology and the clinical features or the degeneration in the brain. So it's important that all levels of evidence are convergent on the concept that losing synuclein may be much more important than eliminating the aggregated fraction of the protein. And perhaps these 2 trials will make us move away from an anti-synuclein approach and begin to consider the possibility that perhaps there is much to be gained by testing the idea of replacing the levels of normal synuclein to levels that can be more functional to the brain.